Good afternoon. My name is Dr. Nellie Maceda, and I'm a physician with New York City Health and Hospitals Gotham Health. I'm happy and excited to be here for the ribbon cutting of the new Gotham Health COVID Center of Excellence in Tremont. I've been practicing pediatrics in the Bronx since 1994, and of course treating COVID patients since March, every single day going to work, treating the beautiful people of the Bronx during this very challenging time. I've seen firsthand that COVID doesn't just affect the patient, but their entire families. In some cases, they experience long-term lingering effects of COVID-19 after the initial treatment ends. Many of my families that I see struggle with the after effects of COVID-19. Some parents take months to recover, which of course affects the children who are in their care. In my practice, I've seen how the lingering effects of COVID-19 has led to an increase in behavioral issues for families, such as a mom who recovered after having had a thrombi and leading to a stroke, then coming home to deal with children that are remote learning, no job to go to, and other effects of sheltering in. As a primary care provider, it is important to have these resources to treat patients like these. That's why I believe this patient is special, not only as a primary care provider, but as a Latina born here, not too far from this Tremont Center. As a matter of fact, I used to take the 36 bus coming down that hill to go to high school. It is this comprehensive and cutting-edge care for people and families who experience these long-term effects of COVID, regardless of their ability to pay, their immigration status, that we most need at this moment. New York City Mayor Bill de Blasio has shown vision, commitment to providing important healthcare resources in all communities in New York City, including the underserved, throughout his time in office. New Yorkers will benefit for years to come through these efforts. That's why I'm so excited to thank Mayor Bill de Blasio and to introduce First Lady Charlene McCray to the ribbon cutting of the Tremont COVID Center of Excellence, Gotham Health.
Thank you, Dr. Maceda. Even in a tough year, we have so much to be thankful for. Today, I'm thankful for the teams at Health and Hospitals, the Department of Design and Construction, and all the leaders who have brought this center to life. And I'm especially thankful for the women who've led the way. Christine Flaherty, Starlene Scott, Tracy Bowes, Michelle Lewis, yes, you can clap for her, all of them. Elsa Cosme, Allison Landry, and so many others. Every day we are reminded that our fight against this virus is far from over. But today, we send a message to people in the Bronx and all across New York City. You will never be in this fight alone. Remember those painful days in March and April when the news reporters would say, New York City is the epicenter of this crisis? Well, it wasn't just our city that was the epicenter. It was neighborhoods like this one. When the rest of the country was worried, families in Tremont were getting sick, losing loved ones and neighbors, and living with the fear that they would be next. It wasn't bad luck. It was because they had been underserved for decades and decades. This virus has exposed deeply rooted health disparities for people of color, and in this moment, we must do all we can to close the gaps. That's why we created the Task Force on Racial Inclusion and Equity, not only to get through this crisis, but to strengthen communities like Tremont, to make sure New Yorkers in our hardest hit communities, many of the same people who sacrifice their own health to keep our city running, have access to high quality health care. We have learned quite a bit about this virus in these last months. New research suggests that people who have survived COVID-19 infections are at a greater risk of developing a mental health challenge like anxiety, depression, or for those who have been in the ICU, PTSD. It makes sense that people would have a psychological response to this illness. The good news is that here, the healthcare professionals will treat the whole person. Right here, people who have fought back against COVID-19 will get the mental health care they need. Trained professionals will make sure no one has to go without care for depression, anxiety, or PTSD. At this center, mental health matters. In New York City, mental health matters. So Tremont, this is your center. May it keep you healthy and whole. Thank you.
That was really wonderful, First Lady. Thank you so much. Thank you for being here. Thank you for all you've done these months to get us through the pandemic. I remember talking to your husband, the mayor, at the worst moments when most people would have only been focused on how are we going to get through the next day. And what he was saying to me is, Mitch, we need an ongoing response that goes beyond the hospitalized patients. We need a way of being sure that the communities that you spoke about so eloquently are really served. And that we take from this horrible experience a set of positive lessons that enables us to do good into the future. And I think this center is a manifestation of that. As Nellie was talking about, we will take care of the long haulers. They have a long haul ahead of them, but we are here for them, the people who have symptoms that are ongoing from COVID. The First Lady has made a priority, recognizing that the whole person means that mental illness is as important as physical illness, that mental health is as important as physical health, and we will treat it as such. Also, the center will address the fact that while so much of the focus of COVID has been on ventilators and ICU, really remember that this is a primary care disease. What are the comorbidities that make it harder for people to survive COVID? Hypertension, diabetes, obesity, heart disease. Well, those are the things we primary care doctors are specializing in. So we can make a difference to keep everybody healthier. So I want to close by some very special thank yous. When you were going over all of the great women responsible for this, Charlene, what I was thinking was about Elmhurst Hospital. There was a very thoughtful article written. People think of Elmhurst Hospital, right? That's really the bravest part of health and hospitals. Well, who works at Elmhurst Hospital? 3/4 are women, right? So who really got us through the pandemic, right? From the chief medical officer, Dr. Mashapur, who's now celebrated 50 years there, through all the women there. So I want to give, Lorena, and I'm going to introduce you, but I want to give you a special thank you because my phenomenal facilities person who used to work for you said, DDC can do this project and they will do a great job. And you said yes. So thank you for that, and to your deputy, Tom Foley, your program lead, Allison Longy, and site lead, Cleveland Adams. I have the most amazing primary care team, starting with my CEO right here, Michelle Lewis, and Dr. David John, Justin List, Dr. List, who's over there, Elsa Cosme, and David Sullivan. We have a broader facilities team, the people who make Christine's work looks so great. Oscar Gonzalez, Starlene Scott, Tracy Bowes, Jeff Lutz, Claire Nawa Kawasaki, Heather McCreary, and Deidre Archie. And then the designers, Perkins, Eastman, and Gilbane, the construction manager. They did this 24 hours a day, 7 days a week, so that we could open it in time, and we are incredibly grateful. So with that, Commissioner.
Oh, thank you so much, Dr. Katz. It has been an honor and a pleasure to work with the folks from Health and Hospitals. We are a team. We worked on this together. I just want to mention that this is a project that is a 22,000 square foot facility that, wait till you get a chance to see it, that was completed in less than 5 months. That's right. A $24 million facility in less than 5 months. I am so proud of the team at DDC who've worked so hard. Lots of the names were mentioned. I'm going to mention Allison, Claude, Cleveland, Rocket Osborne, Daphne Lasky, Sarah Oakes, Diana Conti, and of course the famous Tom Foley. I also want to thank Gotham Health for their cooperation and their help throughout this effort. We're doing this throughout the city in 3 different locations. This is the first one that we're so thrilled to be opening today. Christine, thank you very much for your support, and I just hope this does what it sets out to do, and that is to help the people of this community. Thank you.
Thank you, Lorraine. And public sector works, right? Public sector works. In healthcare, public sector works. In construction, public sector works. We can do it. So our head of both Test and Trace, which now includes 5,000 people, right, the size of a hospital, working to test people. They've passed 60,000 tests in a day. To keep us all safe, to make sure that people can quarantine. Ted, besides being our lead in primary care, the SVP in charge of primary care, has taken on this tremendous assignment and has done it so well. Ted, we're so proud of you.
I don't know if I deserve that, but I've been looking forward to this day for a very long time. Right now, we're very focused on what's going on with COVID in New York City. Today, though, we get to take a step forward and see what the future looks like and how our recovery after COVID looks like. And that's in this building right here, where we're providing in the first ever, first of its kind, COVID Center of Excellence, all of the care that you need if you've had the coronavirus to deal with all of the chronic issues that you may have. This is personal for me. I'm a primary care doctor here in the Bronx. I practice at Morrisania. I've seen my patients throughout the COVID pandemic. And now I'm starting to help my patients heal. But my patients have breathing issues. They have chronic fatigue. They have neurologic complications. And I'm helping them through it. But what they need is something like this. They need a place where they can come to get all of the care holistically in the context of primary care. Unfortunately, 1/3 of everybody in America that contracts the coronavirus will have chronic issues, long-term issues. In this new Center of Excellence, we're building out all of the specific services that you need to effectively recover from COVID: pulmonary care, cardiology care, neurologic care, and importantly, mental health care. In the context of comprehensive primary care, where we've on-site radiology for cancer prevention, on-site mammograms, on-site optometry, on-site dentistry, and specially designed rooms with specially designed air handling. This new COVID Center of Excellence gives us a glimpse of what the future can look like in New York City as we emerge from the coronavirus. And I have to say, after everything that we've been through as a city, after everything the Tremont community has been through, you deserve this. And it's my pleasure to be here with you today. Thank you.
Okay, so we're going to go cut a ribbon and then have tours so that you can see, if you haven't already, what an amazing, beautiful place this is. It's exactly what the people of Tremont deserve. So come join us. We're going to go beyond the barriers? Yeah. We're going to follow you.